Okay, first of all, independent study is in the setting of patients with myelofibrosis who are transfusion dependent. Transfusion dependency in general is a very high-risk condition with median survival of around 2 years for the start of transfusions. And the independent study randomized patients who receive with a diagnosis of myelofibrosis, of course, intermediate 1, 2, or high risk, receiving transfusion of 4 to 12 units in the last 12 weeks. All these patients must be on a stable dose of ruxolitinib for more than 32 weeks. And these patients were randomized to receive 2:1 Luspatercept or placebo. The primary endpoint of the study was RBC-TI, so red blood cell transfusion independency, for more than 12 consecutive weeks, starting within the first 24 weeks. And then other additional key secondary endpoints that are RBC-16, the reduction of transfusion burden, and so on. And I have to say that the population of patients enrolled in the independent study was composed by a cohort of older patients with very advanced disease, so the median duration of myelofibrosis was about 4 years, with a long history of transfusion dependency of about 2 years, and on a JAKi inhibitor. And the vast majority of these patients were on ruxolitinib and few on fedratinib. And this cohort of patients were on a high transfusion burden. Remember that 70% of the patients were on high level transfusion burden, so more or equal to or more than 6 units in the last 12 weeks. And if we look at the primary endpoint result, this has been achieved in 23.1% of the patients on luspatercept. So this means that 1 out of 4 patients in this setting, so on ruxo, requiring transfusions, achieved the primary endpoint. So 1 out of 4 became transfusion independent. And however, the statistical endpoint was not met because the threshold for statistical significance was 0.044. And we do a further evaluation just to understand why this happened. And I think that is of interest, the evaluation that we did according to the regions. And we found that in different regions such as Europe, Middle East, Africa, Latin America, and North America, there was a great difference between response in luspatercept cohort and in placebo cohort. And so this is in line with what we expect in the management of patients with myelofibrosis. But in the Asian Pacific area, there is a very high and very unexpected rate of patients receiving placebo who achieve the primary endpoint. And so we also did other analysis comparing the mainland China that composed the 42% of the population of the Asian Pacific area. And we found that these patients, despite a very low level of hemoglobin at baseline, received in the 12 weeks before enrollment a same number of transfusions than the rest of the world population. And we also study what happened in terms of hemoglobin pre-transfusion during the prospective part of the study. So during the first 24 weeks of treatment, we found that the mean hemoglobin level for transfusion was 5.1 versus 7.4 in the rest of the world. So basically, the unexpected high rate of RBC-TI 12 achieved with the placebo was done due to a more conservative approach in terms of transfusion that is according also to the guidelines in China. We did also a post-sensitive analysis that we perform on a mandatory blinded investigator response assessment at day 169, and basically excluding one single patient who was considered responder because not receiving transfusion for a long period of time due to regional blood shortage. Not consider this patient, so consider this patient as a non-responder, the final p significant was 0.039, so theoretically would be significant. Then the other secondary key endpoint was all in favor of Luspatercept, and these are RBC-TI 16, RBC-TI 12 plus hemoglobin increase of 1 gram deciliter, and also the transfusion burden reduction more than 50%. And concerning safety, we have to say that overall the drug was generally manageable, and all the adverse events were consistent with the phase 2 MF001 study. So basically, the information that we have from the independent study was basically the RBC-TI 12 has been achieved in 23.1% of the patient, and this is absolutely similar to the result obtained in the phase 2 study. And that the reduction in transfusion burden more than 50% has been achieving from 40% to 52% of the patients. And overall, the drug is safe. So I think that this is the final message for doctors treating patients with myelofibrosis. And further analysis will come after with a longer follow-up evaluation of other parameters such as the PRO, mutation relationship, and so on.